Okay, so what I'm going to do in this video is talk about dry needling, why dry needling may be an effective option for someone, and basically take you through the process of dry needling on myself. Hopefully this will let you know that the process is not overly scary, give you an idea about what to look forward to, and again, why we would use it. So dry needling, the term itself indicates that there's no medication or no fluid in the needle. The needle is designed to very, very cleanly penetrate the skin and the tissue so that it is hardly felt by the individual. And the great thing about that is that you're really only going to feel the response to the needle, the muscle's response to the needle, not the needle itself. And so in dysfunctional muscle and dysfunctional tissue, what ends up happening is that the bands of the muscle fibers become very, very, very tight. And you'll find these smaller nodules in the muscle. And then the research behind the dry needling has also shown that there's an increased level of electrical activity, basically, that is happening when it shouldn't be. So we're hoping to reduce that activity to put the muscle back into a normal state and a normal length tension. What that's going to do, hopefully, is reduce any sort of pain that you're having, but also allow the muscle to perform a much better contraction and give that muscle the ability to produce more force. The other hallmarks of trigger points or muscle dysfunction are going to be biochemicals or substances in the muscle that are actually meant to cause pain. And then the last kind of major hallmark is referred pain. So the problem is in your shoulder, but you're feeling it down to the elbow, or the problem is in your hip, but you're feeling it down the outside of the lower leg. So all those things considered, if I can, take maybe a majority of those characteristics in an individual and do a full evaluation and understand that dry needling is really, really an indicated treatment for that individual in that situation, then that's when it's a really, really powerful tool. It's not for everybody, and if we do the evaluation properly, we're really going to be able to make sure that when we do dry needling, it's probably going to be effective. And then if it's an individual where it's not appropriate for, it doesn't make any sense to do it. So the evaluation is still the really critical element of all this. Treatment kind of becomes the easy part after the evaluation. Okay, so with dry needling then, in terms of the actual procedure, I use a clean needle technique, so we wear gloves, we alcohol prep the skin, all right, and basically we've had a lot of, probably over 5,000 treatments at this point, and have never had any skin or integumentary issues, which is great. And then the needle comes in a sterile, oxidized canister, which basically is what keeps it sterile, and they're one-time use only needles, so they're tossed in the sharps container, never to be used again. So for the sake of demonstration today, I'm just going to go onto a forearm muscle, okay? And thankfully I'm not having any issues in this muscle, but again, typically we do an evaluation, we make sure what muscle or what area it is we're going to be going into, always making sure we're 100% safe, and then again, making sure that the treatment, we're doing some sort of pre-testing, intervention, or the treatment, and then post-testing to make sure that it was really, really beneficial, okay? So right now the needle is sitting inside this canister. I will find the muscle, I'll take the needle, I'll break it free, and then tap. Okay, so I have the needle in there, and I really don't even feel the needle yet, and now I have it in my tissue, and I really don't feel the needle hardly at all, okay? What will happen is if I start manipulating this needle within the tissue, then that's when I'm going to start getting a little bit more of a response, and right off the bat I can kind of feel that cramping and twitching down the forearm. So that's where you get the, I would say the uncomfortable nature of the treatment is from the movement of the needle and getting that local twitch response. But thankfully right now I can still talk to the camera, and this is sitting in here, and it's not uncomfortable enough to where it's making me lose my train of thought or anything like that. So hopefully if the evaluation is done right, if it's a very indicated treatment for that individual or situation, and then we make sure that we're 100% safe, and that it's a team decision between us and the individual that it's an appropriate treatment for them, then you get through it, and hopefully it's a really, really powerful tool for you, okay? So that is dry needling 101. I'm feeling just a tiny, tiny bit of kind of a pulsing in the forearm, but Nothing too intense right now at all. And I'm going to take it out, and we'll see what happens. Okay, so 90% of the time probably you don't even get bleeding with the needles. It's basically just the effect of the muscle again. So, you know, if it does bleed a little bit, then sometimes there's a potential bruise left overall, but that seems to be very minimal. The number one side effect that you're going to have from dry needling is going to be post-treatment soreness. So if I would have went through a full treatment on that muscle and got 3, 4, 5 more twitches that I induced there, then it would make my forearm feel like it had a really, really big workout. Outside of that, you know, sometimes people can feel like they're a little bit fatigued or a little bit, I would say like they almost want to take a nap, or they just feel a little overall sense of fatigue afterwards. And depending on the situation and the location, a lot of people have a lot of frustration and a lot of emotion built up in some of the stuff that's going on. And so when you provide an input like that to the body and to the nervous system, it's totally, totally understandable and totally normal for there to be some form of emotional response. So I've had people that they get done with the treatment and they're really, really giddy and they're laughing and they're flushed in the face. I've had other people that, you know, have had an emotional response in terms of some crying, and not necessarily because of the pain, you know, per the report, but because of just that area, something was changed and there was an input there, and it kind of brought this overwhelming sense of emotion over them. So there are a couple other physical side effects, obviously, that can happen, but all in all, it's a really safe procedure. It's so much better than the side effects that may occur from medication or from surgery. If you have a practitioner who you trust, who is certified, who has done many treatments and has good experience, has confidence, and definitely is always 100% safe, then you're really, really going to benefit from this treatment if it's the right situation. Okay? Hope you enjoyed the dry needling demo today. I used myself as an example just to prove that it's intense. I'm not going to sugarcoat it, but when done right and when done properly, you can get through it, and there's going to hopefully be a big result for you. All right? Thanks a lot for watching.